And something that just gets so overlooked and undervalued that our families come in like such a focus on treatment for their child, their teen, or themselves, they forget to take care of themselves.
Oh, 100%. So I have a private practice in North Florida where we help special needs families, neurodivergent families, families dealing with autism and broad neurodivergence, selective mutism, obviously. And that's one of the things that I get the most pushback on too, is when I ask a parent, like, what are you doing for you? When is time for you? And they usually laugh.
No, for sure. It's like, wait, I didn't think of that. I don't have time for me.
Right. Who has time for that? You're going from therapy to therapy and and then when you're home, you're trying to deal with your child or your children, right? You're trying to help them in whatever ways you can. So they always come first.
Right. And navigating the whole family dynamics. One of the things when I was like researching your work, and I was just like amazed, like you and I have a lot of similarities. The biggest similarity is we're both mama bears to an individual that's struggling. For mine, it was my daughter Sophie, who struggled with selective mutism, and you with your son with autism that led you to this career like me.
Yeah, 100%. My son is now 27 and he's living at home with us. He is minimally verbal. He does some speaking, some typing, and some writing to communicate. So it's sometimes really difficult. He has apraxia. So for him, autism hit us in a really big way, and he was diagnosed when he was about 3 years old. And that was back in 2001. So at that time, I was pretty alone. I was pretty on my own. The internet was fairly new, so I spent a lot of time on there, but there wasn't like there is now, right? So,
No, it's the same timing for me. My daughter Sophie was, entering preschool and didn't talk despite her talking at home. And many of our listeners know my story, but I was the same way. I felt incredibly alone. I was getting told she had everything and anything under the sun, where it was not describing my child. And that's where I started with the Selective Mutism Association and started that organization as a means of one bringing awareness to what this is, but also helping people like not just know the term but what to do. And back then I didn't have this, I wasn't doing what I'm doing. Obviously I was a family physician specializing in more children and anxiety. I always had such an interest in anxiety and so forth. So it's like interesting that it all came full circle for you, came full circle for me, and we dedicated our career to this because we as parents and professionals really kind of knew what others were going through and we didn't want them to struggle, right? I mean, was that part of your motivation?
oh, 100%. I hit the ground running with the diagnosis. I'm one of those people. I'm a Jersey girl by heart. So even though I'm in Florida now, but you can't take the Jersey out of the girl. So I was like, hit the ground running, man. Whatever we got to do to fix this, right?
Yes.
Thinking I was going to be able to fix this, and I crashed and burned. I had, my son was 3 at the time. I had a new baby, my daughter Rebecca, who had, issues as well, different issues, but still issues. And it was just it was devastating. It wasn't even on my radar. I was a special education teacher by trade, so the universe does have a funny sense of humor. But this was not what I signed up for. For my family, this, my career was fine, but for my family, that was going to look, the way I wanted it to look. And when it didn't, I crashed. I had a combination of anxiety, depression, and post traumatic stress, all of that. And at the time as a young mom, you're just questioning everything that you're doing. And this was my firstborn. So I just felt like, well, everybody else must know better than me. So I just kept, taking him to different doctors and different and it was funny too because he had a regressive form of autism where he was developing, I want to say normally, but as I look back, it wasn't really quite typical development, and speech was difficult to get. So when I got the diagnosis, it really just hit me, like blindsided me, because this child was so smart. He was spelling his name on the refrigerator at 18 months old, and his name is Benjamin Hershkovitz. So I didn't make it easy for the poor kid. Yeah. So, but he was reading at an early age, and he was doing all of these things. So as a parent, the first thing that you do is say, "What did I do wrong?"
Of course. And that's what a lot of our families are going through now, as especially the newly diagnosed. What did I do wrong? How did I not recognize this sooner? And going to professionals that often really, either see this in a different way, they don't really see their child. That's what we hear a lot, with selective mutism being a social communication anxiety disorder, and that social communication piece, we do have a rather large percentage of individuals in our practice that have autism. They have the ability to speak because they're selectively mute, but in settings, and we're going to talk about it, like the sensory piece, right? That's often a reason why many of them do shut down in that social puzzle they can't figure out. But parents are so focused, at least for this diagnosis, on trying to get their kid to speak without realizing what may be causing them not to speak, and then addressing that and in understanding, the environment and how that affects them. So this self-care is so important, because what I'm hearing from you, and just from your own experience, which is what so many families go through, it's so energy draining, because you have to give so much to not just your child, but holding your family together.
Oh my gosh. Yes. And that's really a good way to put it. My emotional and just energetic bandwidth was like sucked out of me every day.
Because you're either working with your child, taking them, like you said, to therapy, putting dinner on the table for your family,
Mhm.
dealing with your other children that have needs, your spouse, your partner, whomever. And what about you?
Right, right. And so I remember at one point when my kids were little, we're kind of going along, going through the motions, a different therapy every day. My husband was a teacher at the time, and he would come home and be nonstop as well. And so we had, at one point, I had a therapist for me. My husband had a therapist for himself. My son had about 5 or 6 different therapists. And then we had a marriage therapist. And at one point, when we were just really, the marriage was really not doing well, we just said, you know what? We have to triage this, we have to prioritize. And we actually took my son out of therapies for a little while when he was about 6 or 7 years old, just so we could focus on the marriage. And when we did that, I got to tell you, Dr. E, it was like, I thought, I can't do that. Like, I can't put the marriage before anything, because if I do, what if he regresses? And what if I can't get him out? And so I just want to encourage parents out there, if you're afraid of what I was afraid of, don't be. Your child's still going to be there. They're still going to, you'll still be able to, do all the things you need to. But if you as a parent, or as if mom and dad are not okay, kiddos are not going to be okay.
So much sense. I think, one of the first things we can talk about is that, which is what you're, talking about, that emotional load, and managing your own anxiety in this process. What were some of the things, like you said, you felt anxious, depressed, like that emotional piece, your emotional barometer
Oh
is
yeah.
often off the chart.
Yes, I mean, I at that point I was having panic attacks. I was not eating, because when, I'm one of those women that when she gets anxious doesn't eat, rather than eats too much, because my stomach won't let me.
Oh, interesting.
So I had to really get to know myself. I remember the first therapy session that I went to, because my husband, who had been in therapy most of his life for different reasons, was like, "You need to go see a therapist." And I thought, no, I don't. It's probably my thyroid. It's probably this. It's probably that. It turned out I was severely depressed at the time. So when I went and got help for that, and the therapist asked me, "What do you enjoy doing?" I couldn't answer.
Oh, wow.
I had no roadmap for, like, well, what do I like to do? I had completely lost myself.
Oh, yeah, that is so common.
Yeah, so I had to really figure out, like, well, what do I like? Like, what so I mean, I got involved in doing yoga. I started, going to, at that time I was involved with a church that I got more involved with, and things like that. And it really helped to have my own thing separate from the family, from the autism, from the disability. I needed kind of a little bit of an identity of my own. So I loved that I could go to yoga class on a Thursday night and say to my family, okay, you know what? This is what mommy does every Thursday at 7. Good luck with dinner. You guys will be fine. Whatever happens while I'm away is okay. So I had to let go of being a control freak.
Yeah, no, it's hard, especially when you have the kind of personality that you're describing. And I'm very much about like trying to figure it out. I'm like, I guess that's why I went into medicine and I went into osteopathic medicine because it was always about figuring out the whys of a patient. And I was just like obsessed with why. And I think that's become the hallmark of my of my career of why. So all that energy of why. And you know when you see families like you're probably very similar to me. Like every time I see a family, 110% of my attention is on that family.
Mhm.
That's emotional. So I take breaks throughout the day as I'm working with my clients because I need to recharge to be ready for the next family. So you're
Yes.
always giving your own child, and in our case, our patients. But it's no different for families that parents that work and they're giving it to their job in whatever way it is that they're giving. So I think the emotional load and navigating the children's or the teens, whomever you're working with, a lot of kids with SM, it's those other whys, like the sensory piece that I'm is common amongst your population with autism and SM. A lot of kids have sensory challenges and managing that kind of like what it takes to manage that for them to help them navigate this like you're going into a supermarket like
Oh,
so
yes.
many families walk in, get what they need and leave. For someone with sensory needs, which in your case, autism, and a lot of our patients, that's such a navigation in itself. That's so stressful for you to just get through the supermarket.
Yes, yes, and you know, and it's so important. I'm glad you brought that up because learning about my son's sensory needs and my daughter, 'cause they both have sensory needs, helped me realize my own and how much those sensory needs are linked to your emotional state, right? So once I realized, okay, if I'm speaking to my son and the TV's on and the lights are on and the fan's on and the air conditioning's running in the background, maybe in the microwave, there's all these sounds and he can't isolate his hearing to the point where he can hear what I'm saying with all those sounds, even though you and I can, right? So I had to learn how to, if I was going to ask him a question, to give him a cue, to turn down, to mute the TV, and obviously let him know I'm going to do it because if I do something and don't tell him about it and it catches him off guard, he could have, an emotional meltdown. Now, not so much. Now he's adjusted and gotten, better with things like that. But so now to this day, when I ask him a question, I immediately kind of scan the room to see what's going on, to see what he might be distracted by.
No, you just said it. Like what I'm hearing from you, which is something I was going to say, is you're always on. When you're
Yes,
dealing, right? You're always on. You're looking
100%.
around like, oh no, I can see in there. It's super crowded, super loud. That's not going to be a
Yes.
great environment. So for us, when we're practicing our exposure goals, we don't go to Target at 2 o'clock on a Saturday when it's overwhelming, when it causes a lot of shutdown. We
Yeah.
will pick, maybe we will go to Target, but we'll go during off hours and how to adjust it. But the amount of energy it takes to be able to figure this out, to set the world up for our kids is just
Yes.
so draining for so many parents.